Thank you, Mr. Chairman. Good afternoon, Secretary Duke.
Good afternoon, Chairman.
You touched briefly on the area agencies on aging, the 52 area agencies that we have spread across the Commonwealth. And, you know, for my part, I'd like to acknowledge what a key role they play in the care and support of our elderly across the Commonwealth. But that being said, for the last 10 years or so, the area agencies on aging have been relatively flat-funded, and they have been struggling. We've been hearing from them for a period of time, and I know that in your comments you talked about perhaps $5 million being added to them this year to help them in this year's budget, to help them with the problems that they've had to deal with and the expenses they've had to cover over the last couple of years. How does the decision on the PMA affect your thinking going forward? Do we have, can we find money in the general fund? Where can we find money to try to help the AAAs as we get into this budget cycle?
I think that dollars in the governor's proposed budget, you are right to recognize the $5 million, and we see that helping the area agencies on aging in a number of ways, but perhaps with a focus on what we do with our protective services for older adults, or our OPSA program. I think we also see the other dollars that we indicated, the $20 million that'll go to the options program, is helping our area agencies on aging and service delivery, because it'll help with those state-funded services, and so we see that as important as well. The private management agreement would provide the $50 million we're discussing right now, of which the $20 million and $5 million I've just discussed are part moving forward. We have not yet determined, of course, and options, as you know, are still being analyzed by the governor's office as to what would happen if the PMA is not successful in terms of what impact that would have on the proposed budget.
Shifting over to the state plan on aging, you're aware that you're going to be addressing the joint hearing or meeting of the House and the Senate Aging Committees toward the latter part of March. But can you give us an idea, since we finalized that state plan in the last session, can you tell us and give us a bit of a preview as to where we stand today as a Commonwealth to be looking forward to the state plan aging?
I think as you look at the state plan and the 4 goals I had mentioned in my opening comments, you know, if you think about care at the right time, setting, and intensity, I think the work and care transitions that I mentioned is an example of how we're moving forward in that regard. If you talk about keeping Pennsylvanians healthy and well, I think you reflect upon the Healthy Steps for Older Adults program and a chronic disease self-management program that we're implementing across the Commonwealth to help individuals in terms of their personal health. You also think about pieces of information we're developing that can be used in educational outreach. For example, we reach out right now through a webinar series we've initiated to family caregivers so they can access information on their home computer. Often family caregivers find it difficult to get out because of their responsibilities, and we have a webinar series that both is live, one a month, and then we archive that series so it's accessible to family caregivers. You think about those things as examples. You think about work we're doing to have discussions with communities about what they can do to provide services more effectively and efficiently in their home communities. And lastly, with the Department of Aging and the revitalization of aging, we have completed, and an executive board resolution will be published on March 9th, indicating the final ruling on our reorganization. A reorganization we think that refocuses our attention on the Older Americans Act services and the founding services that help meet the needs of older Pennsylvanians. A reorganization that helps centralize the services that are paid for by medical assistants with the Department of Public Welfare, and also helps us form a foundation for moving forward in the future. So that's how we're moving forward with the state plan.
Thank you for that. Now, excuse me, one quick question, if I can, about the state Alzheimer's plan.
Yes.
You know, it was, I think, less than 2 weeks ago that the governor signed the executive order to finalize that plan, that committee. But can you give us any idea at all as to when we might try to convene that committee? Because we are in a relatively short time window.
We have a year
in terms of making a report back.
Right.
And I'm just wondering, you know, now that we have the the ability and the authority to get underway, when might we get underway?
Chairman, we have a year from the date the governor signed the executive order. That's the timeline, the total timeline. And I anticipate invitations will be going out from the governor's office within the next 6 to 8 weeks, and then we'll be able to convene that body pretty quickly after that.
Okay. Thank you.
Thank you.
Very much. Thanks, Mr. Chairman.